Hello.
Good evening, everyone. Myself, Dr. Sunil Alexander, the Secretary of Smart City Branch. I am glad to welcome you all to the fifth CD program of our branch for this year, 2021. I am happy to have Dr. Sujit Pardesi uh, to talk to us on the topic practice management in COVID times. I request Dr. Deepak, our CD chairman, to introduce the speaker.
Thank you, sir. Myself, Dr. Deepak Thomas, CD convener, IDS Smart City. I am very happy to introduce the speaker for the day, Dr. Sujit Partesi. Actually, we are very lucky to get a speaker like him. And to introduce him, I have lots to say. Making people smile to perfection is his profession, and soft skill training his passion. Dr. Sujit Pardesi is best-sell author, international speaker, and practice growth expert. He is the founder of Millionaire Dentist Hub, and he is on a mission to help 1 lakh dentists globally to build millionaire dentist practice. Labeled as India's leading practice management guru, Dr. Sujit has developed special training modules for dentists. A seasoned trainer, Sujit has conducted hundreds of seminars and workshops nationally as well as internationally. He has authorized the bestseller book, namely New Age Dentalpreneur, developed a competitive edge, and built a profitable dental practice, first of its kind by an Indian author or dentist. He is pioneer and solitary professional trainer of this kind in India. He has achieved many awards also. In 2011, he got the Rajiv Gandhi Excellence Award for his outstanding contribution and distinguished service to the nation. In 2007, he got the All India Best Local Branch Secretary Award by IDA. In 2007, he got 4 Avenues of Service Citation Award by the Rotary Foundation. In 2003, he got Dr. Ratan Memorial Award for being the best young member of IDA by All India Dental Association. He is an exemplary person in balancing personal relations without compromising his principles. A man having infectious attitude and contagious enthusiasm, he is appreciated and loved by all. He is married to lovely lady Reena. He is blessed with 2 gems, Anish and Harsh. Sir, on behalf of IDS Smart City, I welcome you, and we expect a great session which is going to be useful for all the delegates who are attending this program. Sir, please.
Okay. Thank you so much, Dr. Deepak. So first of all, very good evening to all of you. And if you're able to hear me, listen to me clearly, just type good evening or loud and clear, LNC in the chat box. If you can hear me clearly, uh, see me clearly, just type loud and clear or
Yes,
Yeah,
sir,
it
LNC.
is
you're
audible,
audible.
sir. It is
Yes,
audible
sir,
and
you're
clear.
audible.
Yeah, that's fine. That's fine. I'm just asking to the, the participants actually. That's fine. Okay, not the panelists. That's fine. Okay, awesome. So a very good evening to all of you, everyone. Make sure that uh, you have your fingers on your keypad. Okay, because see, I'm not a speaker. I'm a trainer, and training is all about interactive learning. So speaking is a one-way communication, and I believe that um, it should not just be a one way. So I want participation from your side. So irrespective of the number of participants we have, so are you ready to participate? If you are ready to participate in this session, just type ready in the chat box. Okay. So all of you, whether you are panelists, attendees, those who want to really, have something from this particular session. Awesome. So I'm so happy, that quite a few of you, and I don't know why others are not ready. Okay. And also, I don't know, because this is in the webinar mode, so you probably know this. Whenever you put anything in the chat, address it to the panelists as well as attendees, so that everybody will be able to see it. Otherwise, only the panelists see what goes here, right? Awesome. So every time you put anything in the chat, address it to panelists as well as attendees. Awesome. Right. So I'll just quickly share my screen and start my presentation on dentistry in the current times or the COVID times, and especially after the the onset of the second wave and how it's going, right? So at the outset, my very sincere thanks to Idea Smart City branch for inviting me for this particular session. And it has been a long time that I have delivered the IDA talk. So of course, in the pre-COVID times, it was always offline. And I have been a keynote speaker in, I think, like more than 200 different IDA platforms, right from the local branches to state conferences, to the national conventions, to the international conferences, to the specialty organizations. And like after the onset of the pandemic, this is probably the first time I'm doing an IDA session actually. So good to be in that zone once again. And everybody, thank you so much for being here this evening. And you people are special. All the office bearers of your branch, as well as you people who are attending here this session, you people are special. You people are special for one more reason, because I always say that only a couple of percentage of people in this world create history. The rest 98% just read it. And no matter where you go, this number somehow never changes. Okay, you will be always surprised to find that it's always a small group of people in each and every field, whether dentistry, whether any other field. It's always a small group of people, minority of people who do the majority of the things, right? So you go to different conferences and you meet the same people again and again. How many of you have seen this or noted this? Type yes in the chat box. Okay, you go to different conferences, you see the same people. You go to different CD programs, you do go to different courses, different hands-on workshops, and you meet the same people again and again. So no matter where you are, no matter who you are, in which field you are, it's always a small group of people in that particular field who keep on doing the majority of the things for themselves, for their patients, for their staff, their family, and the society at large. And your presence here itself shows that you are part of that minority 2% group, okay, who is going to create history in your own way in your practice. And all those 98% outstanding people, I call them outstanding because they're standing somewhere outside, not attending this particular session, right? So all those 98% people are going to read the history or witness the history which you people are going to create in your own way, in your practices, in whichever place you practice. Okay. And it's also said that history is never created by the spectators. It's always created by the players, right? So, and players are the one who do not sit and watch. Players are the one who go to the ground, who go to the field, go through the grind, do all the hard work, take whatever comes their way, the success, failure, bouncing back from the failure, the criticism. Okay. So they make themselves vulnerable to failure, vulnerable to get out, vulnerable to even succeed. So history is always made by the players, not the spectators. Okay. And therefore, you should always be the player in your life. So no matter in which field you are, like, for example, like for today's session, I think all of you are dentists. Okay. So make sure that you are the player all the time. So whether you're in your clinic for half day, full day in this COVID times, maybe restricted hours or whatever. So always be in the action mode. What do you mean by a player? A player never sits quiet, right? The player is always in the action mode. So always be the player, always be in the action mode. And no matter how small, keep on taking the action steps in the right direction in order to grow your practice and create a wonderful future for yourself and for everybody who is associated with you and who is going to be impacted by your future. Okay. So be the player and not the spectators, right? So how many of you want to be the player here? Just type me in the chat, right? So because this particular session can really change your life forever. If you understand the message properly, if you get what I want to convey to you, it will really, you will not remain same tomorrow morning in your practice. Okay, tomorrow morning or whenever and wherever you want to, whenever you practice. Awesome. So I'm so happy, quite a few of you are participating. Few of them are still spectators. That's your choice, right? Anyway, so the session is all about the dentistry or dental practice in the current times, especially after the second wave. And I don't know how many of you ever followed me on Facebook or YouTube and have attended my Facebook Lives. I conducted the first Facebook Live about COVID on March 20th, 2020. That was exactly, I think, March 21st, I think, one day before the first Janta curfew was announced by the Prime Minister. Okay. And right from that Facebook Live, I have talked about many things about the pandemic, about the COVID pandemic, how it shapes up. Like I conducted almost 8 to 10 Facebook Lives from March 21st, 2020 till February 2021. And I would have been happier to be wrong. But unfortunately, whatever I talked about the COVID and how it's going to be the future for the next couple of years, right from that March 21st last year, every single thing has panned out exactly the way I predicted. Now, there's no question of prediction, by the way, because I'm not an astrologer or someone who is a speculator or predicts something. History always has all the answers within. Okay, history has all the answers, and I just went through the history of pandemics and just put forward in front of the dental fraternity. I lectured during the course of time. I lectured for Future Dent or FAM Dent. I lectured for CIPLA. I lectured for Sensodyne. There were lots of sessions which I conducted. Okay. And this is the present state of the second wave. This is the today's screenshot actually. The second wave is, has stopped out for sure in India, right? And I'm sure the situation is equally okay in your state as well. So the second wave has stopped out, and as predicted, it would have topped out in the last week of April in the Maharashtra and in the first fortnight of May in India. And that's what exactly has happened. Okay, so the second wave has topped out now, and this is the time when India's journey from virus to vaccine has taken shape. So there can be a number of thoughts, numerous different thought processes about how India's journey will be and how we should have handled it, whether the way we handled it was right or not. And different people, different opinions. Nobody's right, nobody's wrong, because the situation itself was so dynamic, so new. The virus was mutating all the time. And but then, having said all this, as I was saying, history has all the answers. And unfortunately, the human race never learn things from the history. Okay. And I said it again and again that it's so interesting. Think about this. Why the pandemic should, have its course in the waves. Like once the virus is there, it should either infect everybody and then only it can vanish, right? That should be the natural course of the virus. But then interestingly, every time the world has seen the pandemic right from 1868, like whatever the recorded history, every time the world has seen pandemic, it's always in the waves. Okay. And second wave is always the worst or the most ferocious. So I remember on 20th of February this year, when I did a Facebook Live, I said, is there anyone who attended that Facebook Live? Type yes in the chat. Okay. So, and I said that, India I still remember on that day, we had only 16,000 cases, 16,000 cases in our country on that day. And I said that we will have we will top out anywhere between 3 to 5 lakh cases a day. It was almost impossible to imagine 3 to 5 lakh daily cases at that time. And it was just like 3 months ago. But then that's how it is. The good news is the second wave has stopped out. And I'm sure in your state as well, the second wave has stopped out. Type yes or no if you are seeing the decline in the number of cases in your state, because I actually have no idea about, yes, right? Awesome. So the second wave has, topped out almost in every state, except a couple of places where it's still not topped out. But then I'm sure it could top out in less than a week, okay, if it is not topped out yet, right? So the second wave has topped out, and now it's time for us to come back to the business. That means refocus on dentistry. Because it has been more than a year. When the first lockdown was announced, when we had the first COVID case in India, and everybody thought that it's a matter of few weeks or few months, isn't it? Type yes in the chat box if you were one of them who thought that, it's a matter of a couple of months or 2-3 months, right? Isn't it? Yeah. So many of us actually landed up thinking that, I'll have to keep my clinic closed maybe for a few weeks or few months, and that's it. Things will be back to normalcy. But then again, as the history says, the pandemic takes 2 years to go. So it doesn't mean that the virus goes away from the planet after 2 years, by the way. Okay. It's just that it doesn't remain pandemic. It becomes endemic, epidemic, whatever, depending upon the course of the action steps which are taken by the governments of different countries, states, as well as the public. Okay, so it land up becoming the endemic, epidemic sometimes, right? But then it never vanishes from the planet. And the only virus which there are very, very less number of viruses which we could successfully wipe out from the planet Earth. And one of them is like almost vanished polio virus, then smallpox virus, and so on. So now it's time to come back to dentistry, and because many of us have really had a tough time. How many of you had tough time during this last year, or especially after like in 2021? Just type tough time in the chat box or TT in the chat box. Okay, those of you who really had a tough time as a practicing dentist, right? Because as I said that, we all were thinking that it should be a small duration, but then of course it's never like that, never. Remember, even if we face any pandemic in the future, the real pandemic, so it will definitely take 2 years, okay? No matter how developed the human race becomes. So, and people thought that, 2021 would be better than 2020. But unfortunately, it was not like that. It was more, it was worse. It was bad. It was more ferocious than the 2020, right? But then the good news is the worst is over. Let me tell you, the worst of COVID pandemic is over for sure. Okay, it is unless we individually as well as collectively at the public front as well as the government front, unless we really spoil things in a very, very irresponsible and bad way, the third wave will not be as severe as the second one. Okay, always the second wave is the biggest wave, always. And no matter what your opinion about it is, but then remember, India is one of those very few countries in the world who could control the second wave with such a minimum damage. Now, whether you believe this statement, agree with this statement or not, but I'll tell you what, you might be thinking, whatever the extent of damage it has created, and I'm still using the word minimum. And there's a reason for that. The second wave was 11 times bigger in France. Think about it. The first wave in India was like 98,000 was the top, like 1 lakh. Okay. The second wave would have been like 1 million per day, right? It was 18 times bigger in United Kingdom, right? It was 14 times bigger in Netherlands. It was 8 times bigger than the first wave in Spain. It was 7.5 times bigger than the first wave in United States. Okay. So it was really bad in the Western world. And we could really control it very, very nicely. Okay. Just 4 times as compared to the first wave. Now, you might have, there might be differences of opinion that all the numbers were not shown and so on. But I'll tell you what, that is true for every country. How? Simply because even if there are more number of patients who are totally asymptomatic, who gets infected and recovers without nobody noticing it, including themselves. So the real number never comes out. Whether you hide it or not, the real number never comes out. So the law of averages applies to everybody. So it's not that, India could have been 5 times, but then we didn't show them. Nothing like that, actually. So every country, including Brazil, Russia, nobody is exception to all this. So as I said, unless we spoil things, we have seen the worst already. The worst is behind us. And now if the worst is behind us, and I'll tell you something very powerful now. If the worst is behind you, remember, the best is ahead of you. Again, that's the law of average. Okay. If the worst is behind you, the best is ahead of you. It's always after the darkest nights comes the brightest sunshines. It's always after the worst times comes the best times. Okay. India as a nation is going to see a huge economic expansion within the next couple of years. In this financial year, as well as the next financial year, we will grow probably at the highest pace in the world. Okay. Every field, every business profession will flourish and will flourish to all-time new high. Just want to ask you, how many of you have seen a new high in your practice as far as the revenue, patients, everything, or the practice collection is concerned after the first wave? Anywhere between August, September to Jan, February. Type me in the chat box. How many of you, if you had noted this? Yes, right? Yeah. Isn't it? And that's interesting. Like in the pandemic, these 2 years, you're having the highest practice, right? And let me tell you, bigger the wave, bigger the practice after that, okay? So we all are going to see the very, very good times. And all you need to do is to prepare yourself for that, okay? Dentistry is going to see the best time in the future. The best of dentistry is yet to come in this country, but only for those who are prepared for it. So what to do? What next in the COVID times? The not so good news, by the way, is this. It's not getting over soon. I told you, the pandemic shapes up in the 3 waves, right? And we will have the 3rd wave. We cannot stop it, especially with the huge size of the population of our country, 139 billion people. We need 250 billion doses of the vaccine. And no company in the world will be able to provide 250 billion doses to us in such a short time so that we can avoid the 3rd wave. It's not going to happen for sure. Okay. It's not getting over soon. We will have the 3rd wave. And I told you, if we don't mess things with ourselves and with the COVID virus, 3rd wave is normally smaller than the 2nd wave. Okay. 3rd wave is normally smaller than the 2nd wave. And that's why, if you remember, right from the first week, after the first week of May itself, the government, the Supreme Court, people have already started talking about the third wave. Whereas nobody talked about the second wave in the month of September, October, and November last year. Okay, the mistake which we all made together, the complacency, the thought that the COVID is gone, and that mistake always cost a bigger second wave. The price which you have to pay is the bigger second wave, always. So that always happens in pandemic this way. And the second wave mistake should not be repeated. We should not become complacent. We should not become casual. We should not think that it has gone. That's why they're grabbing our attention to the third wave. And there's nothing wrong about it, actually. Okay. It's not over till it is over, remember. And it's not getting over soon. It will get over somewhere in the next March. Okay. So you can say probably in the next financial year, we will be COVID free. We will be mask free outside our practices. It's not getting over soon. So that's not a very good news. And another not so good news is you will still have to follow all the COVID protocol. Okay. I'm sure all of you, a lot has been said and talked about all this, right? What kind of protocol you need to follow in your practice, and whether that HEPA filter, that UV light, that fumigation, that respirator, and all. So okay, so I'm sure all of you are following the all set of protocols in your clinic. So make sure that, as I said, it's not over till it is over. So you will still have to follow all the protocol in your practice. Yes, yeah, that's a different thing which I was about to come to, in the next slide. That continuing following the protocol even after the COVID. So we'll talk about that, right? So I don't know. This is the link for my YouTube channel. If one of you do not know about my YouTube channel, I have YouTube channel where I keep on sharing the content on practice growth for dentists. So if you want, you can just click subscribe to the channel. And I had done a wonderful Facebook Live last year about the protocols. I have compiled all the different protocols given by the Dent Council, the Endodontic Society, the IDA, and everyone. And I just made a simplified version which every single dentist, whether practice in the rural part of the country or the urban part of the country, can practice and follow. So I made that video. It's still available on my YouTube. If you want, you can just click this link, go to my channel, and get that, right? So continue following the protocol because, as I said, it's not over till it is over. Okay. The next not so good news is I would still suggest that you should still be selective with the elective procedures. Okay. Be selective with the elective. And you might be thinking till when. So, of course, there is no fixed criteria to it. Even if you see one patient a day, that patient can land up infecting you. We all know that. But then out of my own experience, we are practicing since last May, and I'm practicing in Pune. So Pune is the COVID capital of India, right? So the criteria which we are following when it comes to selecting the patient, and interestingly, it has been a year since we are practicing in Pune. We never stopped practicing during these days, right from that time when we started the practice. Last April was the month when we had kept the clinic closed and we started practicing. But be selective for elective. That means you should be very wise in patient selection. So don't be very aggressive while practicing because the virus is mutating all the time. And there have been variants of the mutations which we have seen that, like on day one or like whenever you get infected, you get the symptoms and literally within less than 48 hours, it attacks your lung cells and your CT score is 15, 18, 16 and, you become breathless. So don't think that, I'm young, so nothing is going to happen to me and all. So a lot has been already said and done and has been experienced by the people in our country. And we have lost a lot of dentist colleagues also. So it's not about the age, it's not about your immunity of course it is about it, but in a little way. To be very honest, it's all about which variant of the virus comes to your way. Okay, and nobody can choose it, right? And even if we want to, we cannot choose not to choose it. Okay, so be careful. Don't be complacent that it's gone. It's not gone, by the way. So like for example, when we practiced in Pune, and what we did till the onset of the second wave, till the month of March, mid-March, like whenever there is a senior citizen, we used to do every single treatment, including all aerosol procedures, because normally they were the people who never came out of their houses. Now again, there are exceptions to everything. Like there were people who never stepped out of their houses and still got infected. That's a different story altogether. But then that's what I have seen and observed, that senior citizens and kids are the two very safe patients. As far as of course, you should take the history, ask them if they had a throat infection at any time in the last 2-3 months, 6 months, whether they had COVID in the second wave, whatever. Okay, you take all the history, no doubt about it, whether they are vaccinated or not. So these are the selection criteria, or you can say filters. So we always apply these filters while practicing. If there is like Pune being a very big IT city, so all the IT people who were working from home, we did the work for them absolutely without any anxiety, fear, or doubt. But then there are few IT people who go to office twice a week, once a week, or thrice a week, and they are the risky group actually. Somebody who is into the retail business, into the essential services, is another risky group, because so whether people stay at home and do not go to offices, but then everybody goes to vegetable market, everybody goes to a vegetable shop, a grocery store, on a medical store, isn't it? So whenever we get those kind of patients, we are always very we dig into their history, recent history, medical history, and the COVID history as well. So you can continue following this. So I'll tell you at least till the number of cases drops down to the level of you can say no, I cannot give a month timeline to it, because it's different for different states. The best criteria is till the number of cases drops down to 25% from the peak. If in Maharashtra, the highest number of cases was 68,000, like somewhere around 70,000, you can say. So till the cases in Maharashtra drops down to around 1/4, like 15,000 or 17,000 daily. And that is when Pune was 13,000 in a day. That was the highest. So till Pune drops down to, 2,500 or something, like 3,000. Don't be very aggressive in practicing. Take care. I'm not saying don't practice. Okay. Do all the precaution, follow all the protocol. Maybe do dry cutting if you want to do the air rotor, or use air motor, or if you're using electric motor, make sure that you use less water, whatever. So follow all the protocol. Be selective for elective. This is not the time to be brave. Remember, whenever there is pandemic, and history is full of examples, even if you just sell through pandemic, survive through pandemic, plus minus is equal to 0, that is still fine. Okay. And people probably did not believe this statement in the first wave. I remember few of my course participants told me, I still remember that one day. And when I made this statement, one of my very close course participants called me and he said, "Sir, why are you scared? I've never heard anything from you, anything like this from you." And I told him, it's not about being bold. Okay, you should not be stupid. In the first wave, this statement was, people were probably not taking it seriously. But then there have been a lot of people around us who have lost few very near and dear people. So this is not the time to be brave, to show kuch nahi hota hai, nothing happens. Not at all. So it's not over till it is over. Make sure that you are selective. And even if you get infected, is there anyone who got infected with COVID? type me in the chat box if you want to. Of course, it's your choice if you publicly want to say me, otherwise that's fine. And even if you get infected, it's okay, that happens. Okay, it's okay, that happens. So you go through it, you sell through it. If you have the right mindset, right treatment, early diagnosis, because it has been found that a delayed diagnosis has been the biggest cause of death, and not the comorbidity and all those things, by the way, age. Okay, the delayed diagnosis was the biggest cause of death. So it should not happen, right? So even if you get infected or you get symptoms, early diagnosis is the key, remember. And prevention is better than cure. Take whatever precautions you can in order to ensure that you don't get infected. That's it. So apart from being selective in the work, few precautions which I personally followed and our entire staff followed in our practice since last 1 year. Drinking warm water only in the clinic throughout the day. That's what we did. Then taking steam twice a day, in the morning before we go to clinic, in the evening after we come back to clinic, because normally the COVID virus is into your paranasal sinuses for 3 to 4 days. Okay. And then it goes to lung, normally, unless you get infected with the latest bad mutant, which attacks your lungs in less than 48 hours. So apart from that, almost all the variants, they take around 3 to 4 days to go to your lungs and attack the lung cells. So the steam inhalation definitely helps, right? And then high protein diet, whether if you are a non-vegetarian, vegetarian, you can eat eggs, chicken. If you're a vegetarian, you can eat paneer, soya, whatever. So keep on having a good protein diet, because prevention is always better than cure. There have been a lot of post-COVID symptoms which the world has seen, and it's always better if you can avoid it as long as just do it, right? So that's of course. Meanwhile, if you have any questions, you can ask them. I'll be more than glad to answer your queries. Okay. Now the good news, and I was sharing the good news with you. The best is ahead of us. Remember, one of the the blessing in disguise from the COVID was this, that it has improved, it has raised the standard of hygiene and sterilization in our practices, isn't it? How many of you agree to it? Type agree in the chat box. It was like around 35 years ago when the HIV came, right? That was the time when people started wearing gloves and wearing masks while doing patients. So before that, there was a lot of wet hand dentistry and lots of stuff, right? So it was after the HIV came, we as dental community went up by one standard, like, one step up. And it is now when we are seriously going to use the, I'm sure, we should use the face shield and the respirator, okay, even after the COVID. Make sure that you follow the same sterilization protocol, even after the COVID. So let it raise the bar of, sterilization and hygiene in the dental practice. Okay, so it has improved the standard. That's the good news, right? So, and the second thing is, even the patients have realized that what about fumigation? Yes, you continue doing the fumigation. Okay, you continue doing the fumigation every single day. I'm telling you, like, just like, the surgeons, when they okay, there are multiple agents. No matter what you use the tablets, you use the spray, whatever, but use whatever you want. So I have given a few lists, like go through that protocol video if you want, and I've given multiple options there. Okay, so even the patients have realized that the standard of sterilization, cleanliness, hygiene has improved in the dental practices. And in fact, I'll tell you what, one of my observation. So after we started practicing in last May, a lot of patients have complimented us that the kind of precautions which we have seen in dental practices are way higher than the medical practices. Like somebody compared us with the ophthalmologist, somebody compared us with the ENT surgeon, somebody compared us with the, somebody compared us with the, like any other general practitioner or whatever. And okay, so And still they have found and they have complimented that dentists are really taking very good precautions. And that's a wonderful thing. Okay. See, fumigation corrodes are instruments. Your instrument should be in your autoclave, in your ultraviolet chamber, in your ultrasonic bath when you do the fumigation. That can very easily be addressed. Okay. So the patients have realized the standard of dentistry has gone up. And I'm sure because of the patient realization, even the bargaining in the dental clinics have gone down. How many of you have noted this? Type yes in the chat if you are the one who has noted that even the bargaining has gone down. Because now, see, so many times I get this question again and again, how to stop bargaining, how to avoid bargaining and all this stuff. And I always say, remember why people bargain. People bargain only when, okay, forget about, the so-called Indian habit of bargaining all the time everywhere, including you and me do that, right? So forget about that. But people normally bargain when they do not find the value, the worth. Anything which you go as a customer to buy, when you find it is worth, then you don't bargain. If you do not find it worth, you bargain. So, by improving the standard of sterilization, hygiene, and, all the protocol, we have actually raised the standard. We have actually added more value, and the value is visible. And now when there is a visible value, the bargaining naturally goes down. Okay. Yes, even charge extra to the patients and they still have paid happily, right? Because they know that we are doing all these precautions for them, right? So it's a good thing. So it's a win-win for us. It's a win-win for patient as well. So patient have realized one thing which I'm sure all of you have realized along with all our patients is dentistry is eternal. If you were the one who did not practice for a couple of months in the first wave or the second wave, and you saw that, the patient piled up and a lot of patients were asking for the appointments. And when you restarted the practices was full and you landed up making the all-time high. Have you seen this? Type yes in the chat box, isn't it? So dentist is eternal. That means people will have to come to dentist no matter what. Okay. And that's a good news for all of us. All we have to do is to keep on raising our standards to a whole new level. Because if we do that, people will be happy to pay, right? And as I said, that after the second wave, the businesses are going to, take off very, very fast, very fast. Mark my words, 2 to 3 months from now, somewhere around the Independence Day, the economy will be in absolute full swing, okay? And unless, of course, unless we really are super slow on vaccination, and when I say super slow, it has nothing to about the system or the network or the volunteers or the people to vaccinate. It's all about the availability of the vaccines for us. Okay. Otherwise, even if the vaccination goes at a pace of like around 5 million per day, we will still have a very decently small third wave. That's it. Okay. And the economy will really come back, bounce back very sharp, and including our practices. So remember, dentistry is eternal. And if dentistry is eternal, it's a good news for you. If patients have realized, it's a good news for you. If our standards have gone up, it's a good news for all of us, right? Now it is our responsibility to use this time to grow well. Remember, when you go back to your practices and the practices will become full swing, maybe a month or two from now, you will have no time to upgrade yourself, to prepare yourself, to make yourself future ready about what can you do, or how you can do things even better in order to ensure that your practices go to the next level. This is the time when you have time. Either you're not working or you're working selectively, you're having less number of patients. This is the time which should be used very, very well in order to grow. Okay. And at this juncture, I want all of you to introspect and ask one single question to yourself. How many of you, like I'll ask a series of questions and you'll get the answer to yourself. Okay. Let's do some introspection here. How many of you have seen that the practices have gone down because of the pandemic? Type me in the chat. Okay. How many of you have seen, right, that the, right, it has affected your revenue, it has affected your practice, right? Okay, got it. Now, just want to ask you, you don't have to tell it to me, you don't have to, put it in the chat, but then it's only if you agree to it, resonate with it, you can say yes, okay? When I say about introspection, I want you to realize one thing here. Ask one single question to yourself. Has the COVID pandemic become an extended reason or excuse for me to say that, it is only because of the pandemic, the practice is not growing? Okay, I hope you got it. If you got it, type got it in the chat box. Has the COVID pandemic become the extended reason of telling yourself that the practice is not growing? That means, was your practice growing before COVID? If the answer is yes, good. If the answer is no, if you were the one who was struggling even before COVID, if you were the one whose practice was stagnated even before the COVID, and let me tell you, stagnation has nothing to do with number of years into practice. Your practice can get stagnated even after 20 years of practice, and it can get stagnated like anything. So if you were the one whose practice was stagnated even before COVID, then don't give yourself the reason of pandemic for not growing. Or if you were the one who was struggling even before COVID, so don't blame it on the COVID. It's always said that when people are lame, they love to blame. Instead of blaming COVID, instead of blaming GST, instead of blaming demonetization, instead of blaming recession, instead of blaming the geopolitical issues, take charge of yourself. I want you to take charge of yourself. I want you to take charge of your practice and make it really big from now onwards. That's the reason I wanted you to introspect on one question. Was my practice growing before COVID? And is the COVID real or the genuine reason for derailing my practice? If the answer is yes, then it's good. Then it's okay. Okay. But if the honest, genuine answer is that I was struggling even before COVID, okay, or I was not growing, or I was stagnant. Since last 5 years, I was stagnant. So, and it has nothing to do, as I said, into the number of years into practice. Remember, stagnation is the first phase of decline. Okay. Why? Because you do not go down when you start going down. If you do not go up, eventually you have to go down. That's the nature's law. So if your practice is stagnated for 3 years, 5 years, for a couple of years, you can give all the reasons to yourself. And I gave you a few of the reasons, right? Recession, demonetization, GST, COVID, whatever. But then if your practice is stagnated for 3 to 5 years or more, you really need to work very hard, or you need to really give immediate attention to grow your practice. Because always remember, growth is a sign of life. No matter how small, it should keep growing. So this is for you people to introspect even after this meeting is over. Okay, even after this session. Go back to your numbers. Remember, numbers are fact. Everything else is opinion. Oh, my practice is wonderful. That's opinion. Go back to your numbers. How many patients you saw in like 2018? How many patients you saw in 2019? Number of appointments in 2017, 2018, 2019, 2020, 2021, whatever. Okay, or this financial year, last financial year, 2 financial years before. The revenue in FY18, FY19, FY20, FY21, whatever. Go back to your numbers. It's essential. I'm telling you, because if you do not work on your numbers, you'll not be able to understand the real picture. Reasons make you reasonable. Do not keep on giving reasons. Okay, work on your numbers. And that's the introspection, which is must. Because if you do not do that introspection, you will not grow. You will keep on fooling yourself. And see, ultimately, when we don't, when we are not authentic with ourselves, We do not fool the world, we fool ourselves. Okay, so you need to be very authentic. You need to be very crystal clear with yourself. What were my numbers last year, last to year, and to that. And therefore, I said, use this time to grow. Use this time to grow. Once you do this introspection, the next thing which I want you to do is use this time to grow. There's a very powerful saying: when the fishermen do not go to sea, they mend their nets. So when there is rough weather, when there is a storm, the cyclone coming, so they do not go to sea. What do? They don't sit on the sofa, watch TV and Netflix and eat popcorn or something. Okay, they mend their nets. They do their homework. They prepare themselves so that whenever the sea becomes, favorable, they can go and fish better. So this is the time to build a solid foundation for the wonderful time ahead for your practice. And when you build that solid foundation, you actually land up preparing yourself and making yourself future ready for the practice. Because remember, the best times are always for those who are prepared for those times, right? Those of you who are in the stock market will understand what I'm saying. The stock market has gone up. It has made a new high, okay? But then interestingly, not every share or not every stock in the stock market has made a new high. It's only those who were doing the right things, even in the bad times, they went up, all those companies, right? And those who were not doing the right thing, they were wiped off. The same thing happens here, right? So it's important. It's time for you to mend your nets, prepare yourself, the solid foundation. And if you ask me, there's a very interesting thing which I want to, share with you here. Just want to ask you one question. How many of you have ever thought about this? That, we all are dentists. Maybe we graduated from different colleges, universities, but our curriculum was same, right? So how many of you have observed or thought about this? That in spite of having similar education, our success is not same. What might be the reason? Just type the reason in the chat box. What's the reason? That, like all of us do not have the same practice, same kind of patients, name, fame, money, reputation, whatever. Okay. What might be the reason? Why it happens that in spite of having similar education, people differ in the success? Okay. The way we talk. Okay. What else? Everyone, just give me at least one reason, right? Why it happens that in spite of having similar education, people have different success rate. Dedication, value addition, practice management, okay, anything else? Grasping the craft, confidence, awesome. Okay, see, all these answers are correct. Luck, Dr. Manoj Kumar says, okay. Patient management, Dr. Tony says, right? So our interest in work, okay. So all these answers is correct, maybe except the luck, because when it comes to luck, it's always said, fortune favors brave, isn't it? Fortune favors brave. So it's always like, if you want to be lucky, be brave. And area of practice, okay. I'll tell you what, all these answers are correct, but then they're partially correct. For example, if we take dedication, everybody give dedication to the practice, right? If you say area of practice, that means the one who is practicing in the best area in the country should have the highest practice. But does it happen that way? And the answer is no, right? So there are multiple things, but what is more important is there is something which is very, very powerful. Okay, there's something which is very powerful. And the entire world had this question, why it happened that in spite of having similar education, people differ in their success. And the same single one-liner question was asked to thousands of people across the world. And one very big institution in the world had done this survey. And when the result of the survey was out, the world was shocked. And this was the result. When they said that the contribution of domain skill in human success is just 12 to 13%, what contributes to almost 88% is the soft skills and the effectiveness of the soft skills with which we use them. Now, what is domain skill? Domain skill is nothing but our clinical skills. We all are dentists, that's our domain. Whether we are BDS, MDS, endodontist, prosthodontist, but we are dentists, that's our domain. Dentistry is our domain, right? And look at this, what the survey says. Something for which you have given 20, 25, 30 years of your life, A lot of money, a lot of hard work, a lot of hours contributes to 12 to 13%. What does it mean? And something which have been never taught to us in any dental schools or universities contributes to 88%. Because soft skills, what are they? Soft skills are nothing but your communication skill, your presentation skill, your management skill, your interpersonal rapport building skill, your leadership and team building skill, and your crisis handling skills. So these are the soft skills. Now, I've seen this so many times that when I show this particular slide, a lot of people tend to disagree with it. Because this is the bitter truth, actually, believe it or not. So it doesn't mean that your clinical skills are not important. But let me tell you, there is something which is really important and which has been unfortunately never taught to us. And that's where I want to take your focus on. And I always say this, that dentistry is all about 3M. And the 3M of dentistry are marketing, management, and professional mastery. It's not just about clinical skills. I'll give you a simple example. Okay, think about it. Suppose there is a dentist who is very good in his clinical skills. Okay, and no marketing, nothing. So do you think people in your locality will know you, that you have good work? How will people know about it? It's all about 3M. Okay, it's all about 3M. What is the role of marketing? Marketing, and see, now don't confuse marketing with the advertising. There's a difference between advertising and marketing. So as per the Dental Council, we are not allowed to advertise under the code of ethics, but we can do marketing, right? So marketing gives you awareness, gives you visibility. Marketing gives you, tell people that you exist, first of all. Okay. Marketing tell people that you are expert, you know your stuff. There's marketing which is done for visibility, for awareness, for authority, marketing for education, okay, to educate people around you. What is the role of marketing? The role of marketing is it gives you a lot of people in your waiting room, isn't it? The better you are at marketing, whether it's online marketing, offline marketing, the better you are at marketing, you get more and more people in your waiting room. Those who are in your waiting room are not your patients, by the way. They are your potential patients. They are your prospects. Marketing gives you a lot of prospects, right? Management or soft skills help you to convince the patient for the treatment. Okay. And the clinical skills help you to do the best treatment. Tell me, which M is more important? Okay. Which M is more important? Put it in the chat. According to you, marketing gives you a lot of prospects. Management help you to convince or convert the prospects to the patients, and clinical skills help you to do the best treatment. Okay, which M is more important? Okay, street dental both, all three, awesome. And see, many of you are correct. All 3M are equally important. Remember this forever. Okay, it's not just marketing, it's not just management. All three are equally important. Okay, and why? I'll give you a simple reason. Think about it. If there is a dentist who is good in marketing only, he or she will have a lot of people in the waiting, but then they will fail to convert into the patients because your communication skill, your patient convincing skill, your presentation skill, your explanation skill are not good. So such people have low conversion ratio. They have a lot of people who come for OPD, and then they say, okay, sir, okay, ma'am, give me the medicine, I'll come back. And they never come back, right? So somebody, if you are very good in marketing alone, you will have a lot of prospects, but less patients. If someone is very good in soft skills only, so whenever there is patient, you will convince them for the treatment. Your patient conversion will be high. But the problem is because the clinical skills are not good, the patient will not come back to you again, right? And if somebody is very good in clinical skills only, no marketing, no soft skills, but very good work, it will take a lot of years before people in your locality know that, this dentist is good, right? If you thought this was powerful, just type powerful in the chat box. No single M is more or less important than other. It is effective marketing which ensures that you have a lot of people in your waiting room. It is effective management that ensures that you convert those prospects into your patients. And it is effective clinical skills which ensure that whatever you project in marketing and promise during patient consultation, you deliver the same. If you found this was important, type powerful in the chat box. Because one of the biggest mistake majority of the dentists make is they focus only on clinical skills. Okay, and they think that, you know, you keep on doing a good practice and you eventually people will come to you. And I'll tell you something, that eventually was good when we started practicing 2 decades ago. There were less number of dentists. Okay, there was no need of management. There was no need of marketing. In fact, there were no smartphones, no internet, no mobiles, no Facebook, no Insta, no social media, no reels. Life was easy actually. Okay, you start practicing and practices used to be full. But gone are those days. Nowadays, if you think that because my work is good, I'll focus only on my work, and within 5 years, my practice will settle. And I'll tell you what, in this country where around more than 25 people graduate and postgraduate every single year, even if 1% comes to your place, what is 1% of 25,000? It's 250 new dentists in next 5 years. I'm talking about 1% of 1 year only. Like next 5 years are going to produce more than 1 lakh dentists in this country. If 1% comes to your city, it is 1,000 dentists. So that time is not left, by the way. So I have seen a lot of, not just youngsters, but even the established practitioners making this mistake of focusing only on clinical skills. And they land up with a stagnated practice because they never focus on marketing, because marketing was not required when we started practicing. So practices went up, very well settled practices we have, but the problem is they are not growing. And anything which do not grow up eventually has to go down. So be very, very particular about this. And right from tomorrow morning, I want you people to take this message from this session. Focus on all 3M. Start marketing slowly. Okay, build your digital platforms, build your digital presence in your area, do offline marketing after this pandemic is gone, or the second wave is completely off, like 80-90% cases are down. Okay, it is extremely important because marketing gives you visibility. Marketing tells the people that you exist. Management or soft skills help you to convince the patient for the treatments. And the best clinical skills ensures that whatever you project or promise in marketing, whatever you promise in patient consultation, you walk the talk, you deliver the best results. All 3M are equally important. Okay, so focus on all 3M as you go ahead, and the best time to prepare yourself is now, because you have time right now. As I told you, the best of dentistry is yet to come, but only for those who are prepared. And as it is said that, you know, there is a very wonderful quote by Alvin Toffler actually, that the illiterates of the 21st century will not be those who cannot read and write, but those who cannot learn, unlearn, and relearn. So even if you're a seasoned practitioner, this is probably time to unlearn and relearn something new, because the rules of every game keeps on changing all the time, right? And the best way to do it is to keep on upgrading yourself all the time. So keep on upgrading yourself in clinical skills, keep on upgrading yourself in soft skills, and keep on getting a sense or a hang of marketing as well. Because when you upgrade, it saves a lot of efforts, it saves a lot of time, it gives you better results, right? Gone are those days when there was a crow and once he was thirsty. The crow has become smart, the phones have become smart, the watch, the TV has become smart. It's our time to become smart, right? Keep on upgrading yourself every single year. As Robin Sharma also says, in order to double your income and success, triple your investment in personal development and professional mastery. What do you mean by personal development? Is soft skills. What do you mean by professional mastery? Is domain skills. Keep on upgrading yourself in soft skills and domain skills all the time, and you will see magical results in your life. Okay, this is so very important. And I'll tell you what, 2 best ways to upgrade. Okay, 2 best ways to upgrade. Number one is reading good books. If you want to upgrade yourself, like if you have interest in implants, for example, read best of the best books on implants. Okay. Do the best of the best courses on implants. If you are interested in smile designing or laminates, veneers, DSD or whatever, read best of the best books in that particular field. If you want to learn, some marketing, watch YouTube videos, read some good books on soft skills, communication, how to be better in patient consultation. Because especially for dentists, patient consultation is extremely important because dental treatment is not compulsive. It's not like the angioplasty where patient himself comes and say that, okay, do it right now. In fact, when you tell the root canal, when you tell the implant to the patient, and patient always thinks, how can I avoid it? Isn't it? Dentistry is not a compulsive science. Remember, it's an elective science. It's important to understand. And therefore, patient convincing skills are really important. Forget about the want-based treatment. People don't even get the need-based treatment done if the dentist cannot convince them properly why it is important for their oral health and through their oral health to their overall health. So keep on upgrading yourself all the time. Read good books, attend good courses. And just for your information, I also written a book on dental practice management called New Age Dentalpreneur, Develop the Competitive Age and Build a Profitable Dental Practice. First of its kind, written by Indian dentist or author, written with Black Card Books, Canada, international bestseller, forwarded by Dr. Christian Coachman. Okay, a wonderful book. And then I also have, one more gift to you. Actually, if you want, you can join me tomorrow, night. Every Thursday, I conduct one webinar on step by step. I unfold everything about what are the different steps which are required in order to build your dream practice. Okay, so every Thursday I conduct this webinar. It's a Thursday webinar. So tomorrow is the Thursday. I'm going to conduct this webinar on at 9 p.m. So this is the link to register for the webinar. I just put this link in the okay. I just put this link in the comment box. So those of you who are interested, you can just click the link below, sujit.co/formula, right? So register for this webinar, and if you want to learn more about soft skills and every single step by step, not just soft skills actually, but what all it takes to build your dream practice. So what are the essential factors? What are the foundation? What are the 4 pillars? What are the 3 functions of your practice which you should focus on? What are the 2 boosters which can accelerate your growth? And what is the game changer which can change the game for your practice, right? So this is the time not to be very aggressive when it comes to working, but this is the time to be extremely aggressive when it comes to building the solid foundation and making yourself future ready for the best time to come. Because mark my words, the best of dentistry is ahead of us, but only if you are prepared for it. Okay. So thank you so much. I'll just conclude this presentation. And if you have any questions, you can ask those questions. Meanwhile, I just have one question here. How long should I wear PP if there are aerosol generating patients? So I'll tell you what, as long as the COVID pandemic is over and everybody is vaccinated, at least 3/4 or 2/3 of the nation is vaccinated, till we achieve the herd immunity, you should. Okay. So if there are any questions, they're most welcome. And over to Dr. Deepak. Right. So you can just go ahead. If there are any questions, I'll be glad to answer. I'll be here for some time. And otherwise, yeah. What is the best time to start new practice? Awesome. Very good question, Dr. Kavita. This question was asked to me by hundreds and hundreds of new, practice, like, passed out dentists or postgraduates who want to start a practice. And right from the last April, I said that the best time to think of starting a new practice will be after March 21. So now we are already past March 21. So the best time to start the practice is now. Like if you start your interior and everything, like within the next 2-3 months, we will be ready. But remember, even after that, if we mess up things and if we get the third wave, which is really bad, you will still have some waiting period. But still, why I think this is the good time to start the practice within the next 2-3 months is simply because any which ways you are going to have the waiting period, right? Even without the third wave. So you will sell through that. Make sure that you rearrange or arrange your financials in such a way that even if you don't make a profitable dental practice for 6 months after starting the clinic, maybe a couple of months from now, you should be able to survive financially. Okay. But this is the best time to, this is the right time to start practicing. And most importantly, keep on working, keep on improving yourself by means of all 3M. Okay. It's not just about clinical skills, by the way. Okay. Clinical skills are really important, provided you get opportunity to show how good clinician you are. And the opportunity is always created by the marketing and the soft skills. So knowledge or skill without opportunity is zero. Okay. So no matter how good, for example, root canal you do, unless you have a patient who accept your treatment, you cannot show how good clinician you are, right? So you can start building a base for your practice now. Maybe a couple of months from now, you start practicing. Be better with every single day in your 3M. If you want to know every single thing which is required, join the webinar tomorrow. It's a free webinar any which ways. Okay, join the free webinar tomorrow and make yourself future ready, right? Dr. Rakesh Rajan says, a PP is necessary or a disposable surgical apron? To be very honest, Dr. Rakesh, I use disposable surgical apron. With all honesty, I have never used PPE kit since last year. Because I'll tell you what, once we do the aerosol procedures, and if the patient is infected, okay, if the patient is infected, in that small operatory, even if you are wearing PPE, there are very high chances that you will get infected. So there is no point actually, but then again, do whatever you think is best to protect yourself. So more than our intellect, our wisdom and our common sense, what matters is what gives you the feeling of safety. See, remember, it's all the mind game. If you're safe here, you're safe in your practice. Okay. So Dr. Vidhu Anthony says, marketing is suggested on a regular basis or at a certain interval? Very good question, Dr. Vidhu. I'll tell you what. One of the biggest mistakes people make when it comes to marketing is they do it on and off. Okay. It's like when you're super busy in your practice, when you have enough patients, you don't even think of marketing. Marketing doesn't come to your mind, right? And it is only when for some or other reason the patients drops, whether it is festival, whether it is lockdown, whatever. And all of a sudden you're like, oh my God, the practice is going down. I need to do something. Isn't it? The practice is going down. I need to do something. And that is the mistake. Because you do not do marketing consistently, it does not generate results for you. And I'll give you a very, very simple example. All of you during the festival times have seen the full page advertisements by Amazon, by Flipkart and Snapdeal and whatnot. Isn't it? Think about it. What will happen if you see any particular advertisement only once and then it never comes in front of you? Will you buy the product? Will you even remember that product or company? Type yes or no in the chat box. If you see that advertisement only once, type yes or no in the chat box. No, because see, what is not in front of you does not exist for you. Out of sight is out of mind, right? Out of sight is out of mind. So what is not in front of your eyes doesn't exist for human being. And then all of a sudden you see one more advertisement of the same thing or the same advertisement after a month. What will happen? Oh, I saw it last month. And again, it goes away. The biggest secret of marketing is not the content. The biggest secret of marketing is not the quality. It's the consistency. Marketing is an ongoing activity. Now, a few of the questions are like how to do marketing. What is the ideal way of marketing? Yes, it has to be ethical, no doubt about it. See, when it becomes unethical, when you make false promises, then it's an unethical marketing. So Dr. Sunil also says, what's the best way to market? I'll tell you what, it's very simple. You need the mixture, the combo of online as well as offline marketing. There's nothing good or bad. There's nothing best. There is nothing right or wrong. Everything has its own place in the marketing world. Okay. like Sneha has asked, is the marketing necessary in rural areas? Will it bring the same effect? Definitely yes. But I'll tell you, Dr. Sneha, in rural part, if you are practicing in rural part, the better way of marketing is offline, not the online. Okay. If you're practicing in bigger cities, the better way, or like, it's not better way, actually, it's the more results you will get more results with online marketing if you practice in cities, big cities. Okay. If you practice in small cities or, taluka place or rural practice, focus on offline marketing. Now, marketing doesn't mean you put pamphlets or flyers in the newspaper, by the way. That's advertising, which is not allowed. Right? Marketing is, what you do through your patient, because who is going to market you? Your patients. When will they market you? When they will get a wonderful experience in your practice. How will they get the wonderful experience? When all 3M will be wow in your practice. Right from your logo to your tagline to your external signage, internal signage, the way you greet the patient, the way you treat the patient, the way you explain the treatment. That's what I'm saying, Dr. Deepik. Offline marketing is, one of the best way to offline marketing is socializing and networking, which is very, very effective in the small cities. Okay. So you can watch, I have made a different video on my YouTube channel on this. Okay. So what's the best way to increase the footfall in the practice if you are a new practitioner or something like that? Okay. I've made quite a few videos, why people bargain, why people postpone the dental treatments, what are the 5 mistakes which dentists make. There are quite a few videos apart from few success stories and other stuff. So good. So I hope you got some idea about it. Any other questions? I'll be more than glad to answer your questions. Otherwise, over to the host.
I think almost all the questions are answered, Doctor. Thank you very much. It was a very wonderful session. I really enjoyed it and got a lot of information, especially of the 3M. Okay, we are, yeah. Thank you very much, Doctor. Deepak?
Yes, sir. Shall we conclude?
Yeah, of course you can. So those
we can conclude.
I invite you for my tomorrow's upcoming webinar. It's a free session. Just register yourself at sujit.co/formula. And I'm done from my side. Thank you so much, Dr. Deepak, for this invitation.
And so to conclude, on behalf of Idea Smart City, I would like to thank Dr. Sujit for his excellent session. Actually, there's so many people, like many of my friends, so many practitioners are now apprehensive to start the dental practice during this COVID time. Because most of them are disappointed because when lockdown comes now, the clinics get shut down. So they are really apprehensive what will be the future of the dentist. And that is really a problem which everyone is facing. I really feel that after your talk, this would definitely have instilled some sort of positive mentality in the practitioners who have attended this session. And I'm really happy that even though we conduct this program this program is conducted by Idea Smart City, we have so many participants from Mumbai, Pune, Delhi, and Haryana. I'm very happy to tell that a lot of practitioners from different parts of the parts of India have really attended the session, and I would definitely get the feedback from them, and I will let you know, sir. And I would like to thank each and every member of Smart City and also the other members who have attended the session to make this a grand success. And also, I would like to thank the MedPaper Technology. Actually, they have been consistently supporting us for the past 1 year. And so everything usually comes in a very smooth manner. And a lot of students are also there in our session, those who are attending. That is also going to be an eye-opener for them. So thanks a lot, sir. Thanks a lot for the session. I would definitely keep in touch and give you the feedback for the session. Thank you, sir.
So, thank you so much. And bye-bye, everyone. Stay safe. All the best to you.